Hi guys, this is Matt Bateman from Chiropractic once again, and we're going to go through one of the most simplest shoulder exercises that I prescribe a lot of the time for very acute, very tender sort of rotator cuff issues, potentially even frozen shoulders, basically a stiff achy shoulder that's having problems going overhead. The problem that patients tend to find when they get pain going overhead is they become very reluctant to do so because it's painful. And then the shoulder can get stiffer and stiffer and stiffer. Now this is something that just helps get a bit more range of motion going up overhead, but takes a bit of the load off of the arm so it doesn't hurt too much, okay? Alright, so basically it's the simplest thing, and the way we do it is we're going to start off with the left arm, okay? And the first exercise is just basically up in front. And the way you offload the shoulder is by walking the fingers up the wall, okay? And if you get to a point where it feels a bit tender, just gently lean into it, so stretching into the shoulder, and then ease off and see if you can walk your fingers up a couple more inches, okay? And then lean into it and just stretch. Now, the key thing is that you don't just let the shoulder drop, because that's going to be painful when you're up there. When you're up there, just gently walk the hand down the wall as well. Okay, some practitioners call this the incy-vincy spider. Okay, basically we just call it wall walks. Okay, so we're going to walk the hand up, find a bit of a sticking point, stretch, push it up a couple more inches, stretch, and walk the hand down. Okay, that's the nice simple one. What that becomes a little bit tougher is when we go out to the side. This tends to be the real reason where people get problems. Okay. So here we go side on, so our torso is perpendicular to the wall, and we're just going to look again 90 degrees to the door, or parallel to the door rather, and walk up with the side. Now that tends to get quite tender early on if we're suffering with any joint issues. Lean into it, just gently, and walk up a couple more inches, and lean into it, and then walk down. Okay, all right. The third one, okay, is a kind of a combination of the two. Okay, and what we do is I'm going to use the right arm now to really open it up and show you. So you walk the arm up the wall, get as far as you can, then turn round 90 degrees, and that'll really stretch across the pec and across the chest and the shoulder. Might twinge. Okay, if it does, you stop well before it twinges. Okay, and then come back in and walk the hand down, okay? So these three exercises, okay, I'd recommend doing them about 3 sets of 8, 3 sets of 10 repetitions a day. Okay, we'll run through them really quickly again. So if we were going to use the right shoulder, okay, we just walk our hand up the wall, feel a little bit of a stretch, walk it up a little bit further, bit of a stretch, and walk down, okay? The next one, we go out at 90 degrees, we walk the arm up, bit of a stretch leaning into the door, okay, walk it up a little bit further, bit of a stretch, and then walk it down. The last one, you go front on, walk it up, then turn away and feel that stretch across the chest, push into the stretch, and then leave it. Again, don't do it into any pain levels. Okay, if anything's really twinging, you stop. Okay, about 3 sets of 8 repetitions a day. That'll get the shoulder moving up overhead. Okay, all right, take care and bye bye.